Hi, good afternoon, good morning, good evening from wherever you are listening to me this time. Welcome to our fourth video in the series of the impact individuals, groups, structures and processes have on behavior in organizations. This is Dr. Levila Makobe. I'm a consultant in organizational behavior and structure. And in this series of videos, I'm discussing the impact of individuals, groups, structures, and processes in organizations, specifically home health agencies working in Delaware. So this is the fourth video. In the previous video, we discussed policies that specify the target populations, policies that there is the service limitations, ethics committees. We discussed that. We discussed corporate compliance plans. So the structure of these videos is such that I will tell you the kind of policies that you need, and then I dive into one or two of them so that you can be able to have a feel of what you need so that your agency can be able to have the processes in place to make it successful. Like we have said, in an organization, the behavior is impacted by the people there, the groups there, the structure there, both physical and organizational, and the processes there. In these videos, we concentrate on the processes because the structure should be already set up. The individuals are already determined, and the groups that form in the group in the agency are already determined. So we assume that they are determined. If they are not, we will deal with them in another other series of videos. So we already discussed. In each video, I sort of point at what sort of policy you need, how many of them, or I'll list them, and you can work with them with yourself or with the help of a consultant. And then dive into one or two policies that seem to cause heartburn. In this video number 4, I just say that the list of policies that I think you should take off from there are there. Let's say you need a policy on admission criteria. How and who are you going to admit? You need to say that in a policy so that anybody picking up your policy manual knows what kind of people, what kind of clients are admitted. And your regulators should also be able to know who to refer to you, who not to refer to you. So you have to have the admission criteria. And then you also, when you admit people, you will need to have a discharge criteria policy. And also, because sometimes you will admit people and then realize that you may not be able to provide the services that they need, but you need to transfer them to another facility. So you need to have a transfer policy, a transparent transfer policy, which your clients, their family members, the society knows that this may be a situation where you are transferring your client to somebody else. So that policy is there. And then also, you may not be able to, you may admit people or clients, but circumstances may be such that you don't have the ability or the capacity, or the situation arises where you cannot be able to provide the service. In this case, you need to have a backup of services plan, policy, which is completely transparent, that should a circumstance arise where you cannot be able to provide those services, then this is what's going to happen to them. Moving on, you will also realize that you may promise services, but you will may acquire those services from a contractor. So you need to have a policy of business associates contract so that it's clear how you will contract those services to outsiders to be able to help you. And then you will also need a policy of anti-fraud. A policy that specifically says what you do to ensure there's no fraud going on in your organization. And you have a program to that matter. You also need a program of professional standards. You need to specify what you will do to make sure that all the people you hire and retain to provide services are acting within their professional guidelines and standards. So you need to have that too. And then you know, you understand that every time you take information, there will be circumstances that will require you to disclose that information. In that case, you need to have a policy of public disclosure upfront, so that clients and society coming to you knows what information can be disclosed under what circumstances. That's a policy that should be out there upfront. You know it, everybody knows, and it's available, you can point to it. Then you have a policy, you will need a policy of change of ownership or administrative control. We'll come back to that because that's one of the policies that we in this video are going to discuss, because it poses a lot of headaches and habits. Also, you will need a policy on sexual harassment and discrimination. We'll come back to that too, because that also in small organizations causes a lot of headaches and headaches. So we'll come back to those two, and then finally in this video I'd like to mention that you'll need a policy on plan of corrections, where if the regulators come to your agency and discover that there's something that's not been going on according to policy or according to regulation, you will have a plan of correction to make sure that you are within regulation. So I've given you a list of policies that you need to have in addition to the other ones we discussed before, and we will discuss other lists as we go ahead on in this series of videos. But today I want to focus on two policies that are important, essential, and sometimes ignored until they are required, or they are papered over as if they will not be required, but then when they come in handy, everybody seems not to know that they existed. The first policy is change of ownership or administrative control. Ownership in this case is an assumption that your agency is either structured as a share, a limited by share, or a partnership which is controlled by an operating agreement where each one has a percentage control. And the change of ownership means that the percentage is in ownership is a partnership have changed, in the sense that the person who had more shares than any other person has ceased to have that control. When if you had 3 people and you had a 30, 40 percentages total to 100, if the person who had 40% loses control and therefore has no control, that means there's a change of control. Okay, administrative control. There may not be a change of ownership, but a change of administrative control is there. Or if you change the director or the administrators or the managers, there is change there, and you need to notify the regulators as per the law. You don't have the choice of totaling up, say, okay, they had 40%, but we are left now, we are 60%, now our total is more than theirs. The number is 40, 30, 30, and person with 40 is the majority shareholder, and then if it changes, that's a change of ownership, a change of control, and you need to report it. It is something that should come naturally, but sometimes we want to play numbers and think, oh, they had 40%, but we have 60 now. You had, but the percentages per person are less. Or if you is a company or limited by shares, if the person who had majority shareholding ceases to be that person, and the rules of the ultimate beneficiary owner or UBO require that you declare and report if the person who will benefit from your agency has changed. That is important for both Medicaid, Medicare, and all states. So your behavior towards the ecosystem has to be controlled by the change of ownership or change of administrative control. There is no bargaining about that. And you have this you need to have this policy, and you need to discuss it among yourself. If you do not understand it, you need to find professional help so that you understand it before it's required in your situation. If something can happen to somebody else, it can happen to you. Don't think that what happened to other people cannot happen to you, and therefore that you may not need this. The reason why these policies exist is because they always show up, their need always arises. And the other policy that I need to discuss is the policy on sexual harassment or discrimination. As discrimination is sort of social, that is putting burdens to people which they shouldn't bear, or providing benefits to people when they haven't earned it. That is discrimination. Providing benefits to people who haven't earned it, or giving burdens to people who shouldn't carry it for reasons that are beyond their control. Okay? So, and harassment basically is advances that are unwelcome. This happens very much in small organizations where you start an organization and you are 2 people, or you are one, or you are 3 people. One of you is male, or one of you is female, and you make advances to the other person which are unwanted, but because the organization is so small, they sort of bear with it until they blow up. So if say the policy says that if somebody feels harassed, they need to report to the director, and the director is the one who is making the advances. That is normally a problem, because then it has to end up with the regulators. This is very important when you start an organization, particularly so when the mission or the vision of each founder is not in unison. Some people are coming in for reasons other than the other reason, but they sort of are coming together, and when they are working together, everybody's reasons start coming out, and they start showing that the reason of coming together were not the same. So you need to have those policies written in your manual, and also you need to understand them. The conversation may be uncomfortable, particularly when you want to get something done and you feel that talking or bringing up uncomfortable discussions will derail your vision or mission, but not bringing up those discussions will actually derail your vision or mission when it's critical. So you need to have the uncomfortable discussions, particularly about ownership, particularly about control, and particularly about relationships and unwanted advances. That's important. That controls the impact individuals, each individual in the organization, other groups in the organization, the nurses, the doctors, the aides, the administrators, the helpers, the impact they have in your agency will be determined by how they relate. Or also, the directors, how they relate will be determined by how they think the structure of ownership and control is like. And if everybody has their own idea of who controls what or who owns what, that is the beginning of a disaster. That is the building on sand when you're supposed to be building on a foundation or a rock, a solid foundation. So today we discussed two very key policies that you will need to have in your manual. Not only have in your manual, but discuss them with your partners, with your workers, so that everybody understands that they are there and how they will be used to resolve the situations you think will not happen. Because the reason why the law and the rules and policies are there is because those circumstances arise. You may have a good time now setting up your agency, but when you are in operation, those situations will arise. They will arise with the directors, they will arise with the professionals, they will arise with the workers, they will arise with vendors and contractors. So if you do not have the policy or you do not have a candid discussion on how to carry them out, then you are not preparing to succeed. And these videos are here to make sure that when you start your business or you create your home health agency, you are set up for success. And to set up for success, you must have the difficult discussions. And the difficult discussions arise out of ownership, out of control, and out of personal relationships. And those two policies are the ones that I have seen bring a lot of complications if they are not addressed in advance. Thank you very much. This is Dr. David Frederick Amakobe. I'm an organization structure and behavior consultant. I specialize in healthcare organizations. You can contact me at my address. We will be able to discuss and help you in your organizational structure and behavior. Thank you very much. We will see you in the next video.